But Kamran, I wanted to pivot to something about booster shots, if that's okay, because I know that that's something that's on people's minds, and we know that millions of people have already been receiving booster shots globally, despite the evidence being, from what I understand, a little bit weak about whether people who don't have kind of immune issues or are not really at high risk need them. So I wanted to ask you, as a physician, what does the evidence actually say? What would you tell your vaccinated patients if you had them in the UK about whether they should go for booster doses? And this is actually genuinely a question that we are getting from our civil society representatives around the continent. What do they say to the grandparents and the healthcare workers who haven't even received their first shots, when now we're hearing of 60-year-olds who are otherwise healthy but just happen to be 60 in the UK or in the US getting booster shots? So what is your kind of language and thinking about that?
Yeah, well, thanks for the question. I think, to begin with, on the evidence, I think the evidence is that immunity seems to last pretty well. We don't actually know how long it lasts after vaccination. There is some tailing off. Does that tailing off equate with people then being less likely to be protected against COVID? I mean, I saw a paper just published last week that said even though there was some tailing off of measured immunity levels, that people still remain protected. So the vaccines, even after 2 doses, are remaining effective for several months, and clearly we don't have the data yet to know exactly how long that will last. I mean, on a macro level, there seems to be absolutely no justification at the moment to support booster shots, except in the most vulnerable in the richer countries. So the policy of saying, yes, we're going to provide you booster shots in the adult population, to me, that's that's politics. That's greed. That's politicians try. I mean, let's take the UK for example. The UK's story is one of absolute lurching from one disaster to another, and at each stage the response has been, but look how well our vaccination program's going. So the vaccination program is really a political card. Boosters, to me, are a political card, and for the companies, they're just a way of making more money when the evidence isn't really backing those booster shots. And I think we've made the argument, Fatima and myself and Gavin, in the piece that we wrote back in August, very clearly, that those booster shots should be redirected to Africa, to Asia, to Latin America, to other parts of the world where they are required, so that people you can actually get to 5%, which is what which is incredible that we haven't got to 5% in Africa. We know we should be getting to 50%. It's just embarrassing. It's depressing. All the things that Peter described as well when he was speaking. You say, what do you say to the individual? I think it puts the individual in a very, very, very difficult position. If you're an individual worrying about yourself, your family, perhaps loved ones that that you may have concerns for, I think it puts that person in a difficult position by saying, well, actually no, send my dose to Africa, when that probably isn't going to happen. So I think it's quite hard to expect individuals to say, no, this isn't for me. I refuse to take this booster shot. People could, of course, do that, and people are doing that. The responsibility, in my mind, really lies with the politicians, and it really lies with the people who are running the big pharmaceutical companies, the vaccine manufacturers, because they're caught up in a web of spin. And the web of spin is to promote these booster shots, which they must absolutely know are unnecessary, but they're doing it for the reasons that we're talking here today about. It's either political greed or financial greed, and that's where the focus needs to be. And the problems run very deep. They run so deep that it means that our whole society, our way of living, needs radical reform. We have a society that rewards profit, that rewards greed, that rewards commercial corporate greed. It's not that, oh, you made a 10 billion profit last year, fantastic, can you make that again? I mean, companies are actually judged by how much they increase that profitability by. What do they do with that money? Most of them manufactured their vaccines through public money. Are they giving that back? What are they doing to return that investment from the public purse? So unless we shift our focus as a society to health being central to wealth, making investments based on health. And I think there is some progress being made, at a kind of higher level around those arguments. I think we'll find ourselves in this situation again and again and again.